Hi, my name is Jessica Guglielmo, and this presentation is going to go over the various stress and emotions you might encounter while on shift as a nurse. Did you know that more than 50% of nurses experience moderate to high levels of stress, and more than 60% of nurses have reported emotional exhaustion? This can be detrimental to the health and well-being of you as a nurse. It can also affect your ability to think critically and perform your job effectively. Some of the contributing factors to stress as a nurse include the following. Skill level. Being a nurse requires a high level of skill and constant vigilance while you're on shift. Communication. Difficult communication or interactions with patients, family members, or other healthcare professionals can cause stress while you're at work. Long shifts. I believe enough is said when I say that. Nurses have long shifts. And emotional strain. This could be regarding mortality or grief. Some tips for managing stress while you're at work or at home are communicating clearly and concisely. This can help to mitigate stress around those difficult interactions that you might have. Identify and track stressors. This can help you to strategize how to address certain stressors. Know what you can and also what you cannot control. Take time to recharge. Now, I mean taking breaks at work, but also taking time to recharge when you're at home. Go exercise, go get a massage, whatever it is that helps you to recharge. Eat healthy and exercise. And finally, establish boundaries. Make sure you leave your work at work and your personal life at home. As a new nurse, you're going to have a lot of different emotions. Here are some of the ones I've noticed new nurses having or how they think. A lot of new nurses get overwhelmed. This ties into the other one that down below that goes with too much to do and not enough time. Everything is new. You don't know what to do. You feel useless. You feel like you're always making mistakes. You feel like you're always asking questions. You don't know the answers to anything. And a lot of new nurses tend to take things personally, even from the patient, co-workers, doctors, they take it personally. Some tips for handling these emotions are slow down. No matter how much you have to do, make sure you slow down. This can help you not make mistakes and also to calm down yourself. There is no such thing as too many questions. With a few exceptions, most nurses will not mind you asking questions. Ask them. In the same vein of thought, it is okay to ask for help. We would rather you ask for help and get it right instead of making a mistake later on. And look from a different perspective. If you are being really hard on yourself, if you had a coworker or a peer going through the same thing, what would you tell them? Would you be hard on them? This one's going to be a common theme throughout this presentation. Make sure to take breaks. Take them at work. Take them when you are at home. You do not have to do everything. A lot of new nurses think they have to get every single thing done. While that's great if you can't, ask for help or even endorse it to the next shift. It is okay that you're task-oriented to start out with. A lot of new nurses are simply trying to master the tasks. That's okay. The critical thinking will come once you master the tasks. If all this continues to be too overwhelming and too much, make sure to speak with your mentor, your preceptor, or even your manager. They might be able to help. For a lot of new nurses, one of the hardest things to cope with is dying patients, especially if it's unexpected or a young patient. A lot of nurses get the emotions where they feel compassion for that patient, that family. They feel sad when the patient passes or is going through a difficult time. And sometimes they feel helpless. Compassion fatigue is a real thing, and a lot of nurses feel it. It doesn't matter if you're a new nurse or a nurse that's been there for 20 years, you are at risk for feeling compassion fatigue. Some of the symptoms to watch out for are a lack of sympathy, anger, exhaustion, depression, decreased passion for career, dread coming to work, anxiety, and sleep deprivation. If you feel you might be at risk for or are currently experiencing compassion fatigue, here are some tips. First, Know that you are not alone. There are other nurses, your family members, your managers. They are there for you. Acknowledge your feelings. Know what you're feeling so that you can find ways to cope with it. Reach out to others. This is similar to you are not alone. Reach out to your preceptor. Reach out to your manager. Again, take a break. Separate your work life and your personal life. That's all about setting those boundaries. And if all this isn't working and it's really affecting you and your life, make sure to seek professional help. Another real type of patient that you will probably have to deal with are aggressive or violent patients. While those in the ED or psych settings have to deal with this more often, even if you're on a med-surg floor, ICU, pediatrics, you will probably encounter aggressive or violent patients or even family members. So it is something that nurses need to be able to cope with. Know that aggressive or violent patients, it can be verbal, it can be threatening, and or it can be physical. A lot of nurses can feel anger, frustration, guilt, or burnout. And a lot of nurses have a conflict between the perception of duty to care for that patient versus caring for themselves. Some tips for handling aggressive patients include working on communication. Make sure to ask them open-ended questions. What is going on with them? Make sure that you are clear in what you are asking them, what you are about to do, and what boundaries you have. Make sure that you keep calm. Never let anything that you might be feeling inside show on your face, and also just make sure to calm yourself in general. Know where your exits are. Never let the patient come between you and your exit. If possible, and this isn't always possible, especially with highly confused patients, but try to build a relationship with that patient. A lot of nurses who can build a relationship have a lot less aggressive patients. Make sure to depersonalize. This is about not taking things personally that the patient and or family member might be saying or doing to you. Talk to someone. It is a lot to take care of an aggressive patient. Talk to a coworker, a peer, a friend, a mentor. Again, take breaks. And finally, don't be afraid to ask for help. Ask for help from another nurse, your charge nurse, your mentor, and or you can always call a code gray to get security there. De-escalation techniques. Now, I want to preface this with saying that a lot of hospitals have their own classes and protocols on what type of de-escalation techniques they want you to use. That being said, here are some general de-escalation techniques. First, make sure to speak clear and calm. Work on your communication. Have non-threatening body language. Make sure to treat that patient with respect and be supportive of whatever issue that they're having. Respond to the patient's expressed problem. Address what they're saying directly. And make sure you set clear limits for the patient, boundaries. And finally, sometimes environmental controls can help. You can dim lights, make sure the noise levels aren't too high. Thank you for listening to this presentation. I really want to leave this with saying always ask for help and make sure to take care of yourself and take breaks. If you have any questions or need any help or just need anybody to talk to, you are always welcome to reach out to me as well. Here is my email and my phone number.